Hello, everybody. All right, we're slowly getting users trickling in. We're going to give it a couple minutes to get going. Super excited for everyone joining today. Hi, Teo. Happy New Year. Leanne. Teo, I still have plans in 2026. Hopefully sooner rather than later, we're going to be bringing you some yummy malasadas or something because you're always awesome joining these forums and everything else. So super excited. Want to appreciate you. All right, we're 12:30. This is going to be a jam-packed session, so I definitely want to get started and get the ball rolling. We're super happy today to have HSAG joining us. If you're familiar with them, they're the new quality improvement organization for Hawaii. So excited to have them here to talk about what they're bringing and what the year is going to have. Jackie, I think we've got our agenda coming up. Just kind of going over, we are going to introduce ourselves as always internally with HHIE. And then Mark is going to be presenting some slides about HSAG and what they're going to bring to the table. We are going to open the floor for some questions at the end if you guys have any for them. And then if we have any questions as well from us, we're going to be asking those as well. And then we'll wrap up with some updates and conclude the session. So kind of getting into about us, if you've been here before, you know my name's Clarissa. I am the Director of Provider Services with HHIE. February will be a year, so I'm excited to celebrate a year with HHIE. February is also the marker of when I became a family nurse practitioner. So you know that that's what I bring to my job at HHIE. I've been a family nurse practitioner for 8 years in February. I've worked in clinical settings. I have done med surg as an RN. I worked in the ER as an RN. And then when I became an NP, I worked in acute care, urgent care setting. I also worked in family practice, and my favorite, pediatrics. It always has my heart. So kind of coming out of that clinical environment, I wanted something different. I wanted to use my clinical experience in a different way. And I felt like informatics really had that piece that was missing. I loved being that super user in just about every EHR I used. And I really enjoyed the user experience, making the user experience better. And so when the position came open for HHIE, I definitely stepped into it with open eyes and really moved forward. I feel like this year has been such a growth period for myself and for our team. I love what I get to do. If you've done a CHR training with me, which is the Community Health Record Portal or Notify, you know that I really try to get to know who my users are, and I really tailor those trainings to fit their workflow and really make get streamlined to get the data that's super important to them. And I really feel that through the projects, I've gotten to work on projects. If you were here last time, I talked about the Keiki Health Insights project. So that's kind of the biggest piece, and I really love what I get to do. So happy to share, and then I'll turn it over to Jackie. Jackie's been with us since July, and was just telling everyone that she's kind of like we're the dynamic duo. We've hit the ground running and really enjoyed having her on board. So I'll turn it over to her.
Yeah, thank you, Clarissa. Clarissa is the yin to my yang. So where she had a heart in pediatrics, I had a heart in geriatrics. I am a speech pathologist by trade. Can't even say that word, even though that's my job. Neither here nor there. But so I did that for about 10 years. I actually saw some people from one of the hospitals I used to work at. I'm not going to name names, but where I work or what I do here at HHIE is I kind of work on the back end thing. I also really like enjoying the user experience and helping improve on that, but more on the side that is internal and that can't be seen, and finding ways to advocate for our clinicians and to improve processes so that things go smoother on your behalf. So what I do is I work on the registration portal. I do all the resets, the passwords, and get people access to the systems. So I don't get seen as much as Clarissa, but I am here usually, and I usually answer my email fairly fast. The other thing that I do, and I want to do a little plug, is I work on our LinkedIn. So if anybody hasn't followed us, please give us a like, because we actually will post this session on our LinkedIn after this is done. So if any of your users didn't see it, it's uploaded to our YouTube, and then I actually will upload it to our LinkedIn so that if it was missed, it can also be rewatched at a later time. I am really excited to introduce our guests. I was familiar with them because I did nursing home admissions here in Hawaii, and I used the ePassR. And then Clarissa said she was going to set this up, and I was like, wow, they actually do quite a lot. So I'm really happy to introduce HSAG and let them explain all of the things that they do in our community.
Padma, you want to go first?
Oh, thank you. Hello, everyone. I'm so glad to be here. I'm Padma Tagarsi. I work at Health Services Advisory Group as the Senior Executive Director. I support outpatient practices such as yours in reducing reporting burden, improving clinical outcomes, and strengthening overall quality performance. And I lead this project. Next. Mark?
Mark Stewart. I'm a consultant based on the East Coast. I've been working in and around and on this QIO program since about 2012, and have worked across all the settings, outpatient clinical practices, nursing homes, and hospitals. Shilpa?
Hello, everybody. My name is Shilpa Wise, and I'm one of the health informatics specialists here at HSAG. It's really nice to meet you all virtually, and I'm really grateful to HHIE for giving me this opportunity to get introduced to you all. I will be leading much of the outreach and working directly with practices and you all to support improvements of your quality measures. So if any of your front desk staff text a message for me, or if you receive a voicemail from me, please know that it's from me.
That's it for our team.
Awesome. All right, Mark, if you want to share, you've got your slides and ready for you to kind of tell us a little bit more about what your team's going to be providing and what we can expect.
Thank you. Can you see the slides okay?
Yeah. We're looking at a different screen. If you want to go to display settings and switch your screen or flip the presenter, we're seeing like your presenter mode.
Is this any better?
We're not seeing it in slideshow mode now.
If you click F5, it'll automatically just be a slideshow.
Can you see an objective slide?
Yeah.
Yes.
Oh, great. Thank you. I apologize for that. We even had a run through. So one of the things we'd like to do today as the HSAG team is just give some clarity around the quality improvement priorities set out by CMS to enhance care and outcomes for the population in Hawaii, highlight some of the benefits are available through partnering with us, and then, of course, sort of next steps on how we can partner together. And I should say right at the outset, this isn't about creating new work at your practices. This is about having assistance with the work that you currently do. So the program itself is the largest federal program dedicated to improving healthcare quality at the community level. And I should also take a second just to say that this program has been around, I think now getting close to 50 years. So this is a program that has lived through multiple administrations and continues to go on even when there's government shutdowns. It's seen as essential work. So the QIOs are now networks. When it started out, there were 53. I'm going to show you a map in a second. There's currently 7. We have Arizona, California, Hawaii, Nevada, and American Samoa, Northern Mariana Islands, and Guam. So this is that map for this 13th scope of work. The first 10 were 3-year scopes, just to give you some history of how long this work's been going on. And it first started with 53 different companies doing the work in each state. Over time, CMS has narrowed it down to just these regions that you can see displayed here. Of course, we're shown in the orange. It is a 5-year scope of work since the 11th scope. And I should also just provide some clarity that when you sign on to work with us, you don't have to agree to 5 years at the outset. You know, it's collaborating, trying to meet your needs to improve performance on, if say, for example, you choose some performance measures or however, we can sort of just work together for the time that's best for the practice. So you're not required to have to participate all 5 years. The biggest highlight probably for the practices on today's call, and thank you again for this opportunity to present, is this is all no cost to the practice. So all of this hands-on technical assistance that we can provide is free to the practices. We've been funded by CMS to do this work at the, in this case, clinical practices, but we also, part of the scope includes nursing homes and hospitals. This is a slide showing the priority focus areas, and they're kind of small, but I'm sure you'll see that these are relevant to the population of Hawaii, and there's high incidence and prevalence of many of these, but it's mainly around chronic disease prevention and management. There's a big component around behavioral health integration. And the last two areas, patient safety has been a part of this work forever. Interoperability is one of the newer areas. We wanted to develop a slide to highlight some of the benefits that can be provided to providers through this targeted support. This is real time and is tailored locally to the practice and the practice's needs. We're not sort of ever gonna parachute in and claim to have some solution for how things need to be re-engineered. That's not the point of this work. It can augment your internal quality efforts using these resources available through the staff at HSAG. Another big piece of it is around this peer collaboration, learning communities. These really took off and accelerated during COVID. There were hundreds of national learning events where we can, as QIOs, facilitate exchange of knowledge and share about best practices. All of it is sort of on demand to meet your needs. And of course, it's always data driven. We, with partners in each of these states and like HHIE, will be able to enable timely, relevant improvements. This sort of builds on the last slide, just to reiterate that we do develop shared goals with the practice. This is never us coming in with an agenda other than to collaborate. We can co-create the action plans and offer prompt, responsive support when it's needed most. As you can imagine, we've had to flex in certain areas at certain times over time based on things like emergencies and wildfires and things. We can be a trusted resource. That's one of the things we'd like to do today, is just start to build that rapport and show that we can be trusted. And ultimately, one of the biggest benefits is you can sort of ease the workload of your staff by having this no cost support available to the practice. My colleague Padma is going to take you through some of our past work just to show and demonstrate our capabilities in this area.
Okay, in the interest of time, I'll just go through these slides. So last scope of work, we worked in partnership with Partners in Care Foundation in California and Area Agency on Aging in Arizona. And we actively promoted the no-cost chronic disease self-management education, diabetes self-management education and support, and fall prevention and mobility workshops. And these programs were advertised directly to the practices so that they could use these community resources to help their patients change their lifestyle, because chronic disease are could be because of lifestyle. And in addition, we hosted and promoted educational webinars led by recognized subject matter experts like the National Kidney Foundation, the American Heart Association, the Arizona Department of Health Services, and the California Department of Public Health. And these sessions focus on practical, actionable strategies and tools that providers and practice managers could implement immediately. Next slide, please. This is the one. This is where I was talking about. Next slide. Yeah, I'm really proud of this project. We helped over 24,000 providers across the country, including Hawaii, where we assisted 24,000 MIPS eligible providers, clinicians participate successfully in quality payment program. And we engaged over 96% of our MIPS eligible clinicians. We received a satisfaction rating of 98% from clinicians, which is really high. We have experts like Shilpa helping with providing technical assistance, and their knowledge is so deep, I can't even tell you. So because of, assistance from Shilpa and others, we helped achieve 95% provider participation in the quality payment program. Next slide, please. So how we provided that information was that we had on-demand individualized technical assistance. We had this phone line open for 12 hours, and they could just call with any specific questions they had. We developed user guides, step sheets, annual reporting plans so that they would, start from the very beginning and not get the penalty. Something that practices are still using are our audit toolkit, and that in case there was an audit by CMS and they can do the audit for about 5 years or 7 years, they have everything in place. And we also offered monthly QPP webinars, just covering what they need to do every month, and provided specific training webinars for ACOs and IPA participants. Next slide, please.
So thank you, Padma. Just as sort of next steps, we'd obviously love to be in touch about the support we can provide. If it's something that's agreeable to the practice, then we'll send this form provider services agreement that we would complete with the practice in order to get to work and be engaged and collaborate. This is the information for how to reach out to us. So the initial practices were selected by CMS to receive support within each state. We don't know what their selection criteria was for the list. Excuse me, we were just given the lists of practices to reach out and collaborate with. However, we are able to recommend additional practices and nursing homes and hospitals across all care settings to CMS. Our first list is actually going in tomorrow, but this is a rolling effort, and we will be able to provide names of additional practices. So this email address of physician office support at hsag.com is the best way to reach out. And so thank you again, and mahalo.
Thanks so much, Mark. Super excited to show how HHIE can really be a part of that conversation with those practices. I think it's really important to highlight, I love that Shilpa brings that IT focus to that workflow, because a lot of it is kind of helping the practices understand what their EHRs can do and the different tools like that, what the Community Health Record portal or the Notify portal, that is an opportunity for those clinics to take advantage of, that's available to them. And so we just want to open the floor. I don't think anyone's had any questions so far, but we do want to open the floor up for questions. I know that Jackie and I have a couple that we'd like to go through as well. So since we don't have any to start, we can go ahead and ask a couple questions. Jackie, do you have one that comes to the top of your head as like a question you want to ask? And we'll wait to see if any other questions come in from the audience. I think you might be muted. I don't know if you spoke. You are muted, Jackie.
Sorry about that. Yes. I do have a couple of questions here. So, we talked about the no cost hands-on technical assistance that is offered. Can we just go a little bit more into that so people know exactly what it is that you can offer them when you do provide that?
Okay. The no-cost technical assistance. That means we are like CMS-funded consultants. We can provide them any help that they need within the CMS priority focus areas. So those are chronic disease management, behavioral health, patient safety. What was the other one? Using technology to improve the care of patient outcomes like EHR optimization. And we engage with the practice one-on-one and come up with a strategy of how much or how little engagement they would need from us. And then they let us know which measure that they would like to improve upon. And based on that, then we do a root cause analysis. We identify gaps in care and then suggest quality improvement plan that they do. So again, our no-cost assistance takes different forms. We can give them on-site assistance if they need, or we can give them virtual assistance or ad hoc assistance via email or phone call.
It looks like we do have a question from the audience, and they are asking, will you provide training for MVP?
Yes, that's in our wheelhouse. Yes, absolutely. It's something new, the MEPS value pathways, and that is what we are going to do. Yes. If you select that or whichever pathway you select to report on, we will certainly help you participate in that reporting option.
It sounds like there's a really good opportunity for the practices to identify maybe areas where they need help with. As far as I feel like in Hawaii, we have our own unique geographical as well as cultural kind of factors. I've worked in many different states, and Hawaii is its own unique healthcare landscape. One of the questions is about the unique strategies specifically for addressing behavioral health and chronic disease. Is there any strategies that you guys are bringing forward as ways to identify those or help in this community while bringing that focus forward that Hawaii is its own unique healthcare?
Yeah, and we recognize that. So we are in the early stages of recruiting and collaborating with practices, and the practices will have suggestions that we will welcome. At the outset, I suspect that we can address behavioral health issues by I believe that we can address behavioral health issues by integrating behavioral health screening and follow-up into primary care workflows, supporting culturally responsive care models, identifying ways to leverage data for care coordination across islands, and aligning with community-based and social service organizations. And currently, we are also doing an environmental scan where we are identifying community-based and social service organizations that we can connect the practices with. We will support telehealth enabled and team-based approaches where appropriate. So we recognize that Hawaii is unique and it has unique needs. We'll try our level best to help you with addressing your behavioral health issues the best we can. And also we do have some subject matter experts that we consult with who are Hawaii residents and will be helping us.
Oh, that's awesome to hear. Thanks, Padma. Jackie, you have any other questions?
I think HHIE, we are a data repository, and a lot of what we do is through collaboration and connection. So can you just talk a little bit about who you plan to collaborate and work with here in Hawaii in the future, or if you're already doing so?
Okay, Matt, can you take that question?
Yeah, we have reached out to many contacts, including some of the IPAs, and also have connections within the State Department of Health. And we're looking
Awesome.
for more partners, including community-based partners.
And including you, the HIE.
Yeah.
Thank you.
Way to put our plug in there. Thanks, Padma.
Thank you.
I think that that's awesome. One of the things, just kind of lastly, we'll kind of finish up before we wrap up the conversation, and we want to thank you guys so much for being, a part of the call today. But one of the things that I had a question about was kind of how to measure that. How do you measure success? Are you sharing the progress just internally to the clinics that you support? Is there going to be any progress shared with the community as far as that? And then with the measures, how do you quantify success with the measures that you're looking to improve?
So we have been given certain evaluation criteria by CMS. So let's say if it's hemoglobin A1C that they want to control, we want to see that the hemoglobin A1C is under control. We will be sharing data with the practices who are participating with us. We'll be sharing regional level data, and also for all of Region 7, and also the local, how they compare to other practices in Hawaii. I'm not very sure how we will share it with the whole community. That will depend if we get the approval of the practice and they themselves want to share it with the community. Anything to add, Shilpa and Mark?
Just that you'd mostly be seeing your own data. We're not going to compare to other practices.
Yeah, I think Anita kind of builds on that. She asked, how do we access the data? And is the data specific to Hawaii state?
Yes, it will be specific to the Hawaii state. And you can access data. CMS will give you access to their database, and you can access it there, or we can also share the dashboard reports with you.
And then
Yeah,
Dr.
and I
Burton.
also,
Oh, go ahead. Sorry.
no, I was going to say that if any of the practices are already associated or affiliated with an ACO, please continue working with them. Our work does not disturb any of the current works that you're doing. We complement the ACO's work. So, and some practices have let us know that it is so good for them to have us as the backup resource when they're not able to reach their ACO or their EHR vendor. So always have us, in case you need any data validation, in case you need explanation about the numerators or denominators of specific measures, in case you have any questions about the quality payment program, we're here to help you. And we can even do more. So I just wanted to add that.
Thanks, Shilpa. And I think this one may be for you too, Shilpa, is Dr. Burton. She asked, are you able to assist navigating in a wide variety of EHRs? Because that's definitely where we are. There's so many.
We do. And we do have experts in EHRs as well in our team. And we will be able to analyze the workflow, check, if there is any bottlenecks in the workflow, and the documentation accuracy and everything. Yes, we will be.
So I'll add to it, Rebecca, that we have been working with EHR since 2007, since the docket days. And we know a lot of EHRs, from Epic to some to Office Ally, Practice Fusion, eClinicals, NextGen. We have experts. We even have experts who can do query writing. So if the data is being unable to be extracted from the EHR and they have the SQL database, they would be able to write the query and extract the data.
Oh, that's awesome. Thank you. Yeah, that's what Rebecca said. We have over 26 EHRs in Hawaii.
Great.
So a lot of different varieties.
Yeah. Yesterday too, when we attended the State of Reform, we talked about how data is the future. So being able to access that, utilize that, and really take it and put it towards your advantage, I think is going to be really important. I think we're wrapping up here. We have about a minute left, so I'll let Clarissa finish off with our closing remarks, but I do want to echo the sentiment of thank you so much for your time today. We appreciate all the good information that you were able to share with everyone. So go ahead, Clarissa.
Yeah. Again, thank you guys so much. I think this is going to be an awesome 2026 moving forward. We're really looking forward. One of the things that I think highlights too is that really want to focus on outer island outreach in 2026 from an HHIE perspective. And it sounds like you guys are right there with us in that effort to really reach the rural populations and the practices and provide them with the tools that they need to be successful with meeting these CMS measures and helping those providers be successful. So super excited moving forward. So a couple closing remarks. We did attend the State of Reform yesterday. We are looking for some upcoming conferences we're going to be attending as well. Jackie, you're going to be on the Big Island. You and Dr. Burton are going to be on the Big Island next week as well for a conference attendance. And then we also are looking forward to the Big Island Symposium. We went last year. It was a great conference. We're going back this year. If anybody has any conferences that they would like to provide us to join, we'd love to have your input. I think we're going to the Big 10 event as well in February. Really excited about being out and being there. If you have any questions, if you want help with the registration portal, if point of contacts are on this call today and you need help with the registration portal, adding, removing users, Jackie's contact info is there. If you want to schedule a CHR or notify training, or you're interested in what HHIE services are, please reach out to me. My contact information is there, as well as Dr. Rebecca Burton. Oh, and then Rebecca's going to is that the family practitioner or the family practice on Kauai next month. So that one's going to be an exciting opportunity as well for a conference attendance. For our data connections, we are still working through our Hilo Benioff Medical Center data connection since they went live with Epic. So we're hoping to have updates on that soon and get that connection back up and running. We're super excited to kick off our audit. It's going to be going live this month. So for points of contacts, you probably will see a verify users notification pop up on the registration portal. Just be looking for that to kick off probably by the end of this month. But we will have a copy of today's slides. We're going to be sharing those. Mark's going to provide those to us. We also will have this on our LinkedIn as well as our YouTube channel if you want to reference back to it. Mark, and then your contact information was provided. I think you put it in the chat as well, if anyone has any questions or want to reach out to you folks.
That main email inbox. And just again, thank you so much for the opportunity. Really appreciate it.
Yeah, awesome. All right. Well, thanks everybody for joining. Have a great day.
Aloha.